Welcome back, everyone. I hope you enjoyed your lunch. Our closing live speaker for today is an OBGYN physician and advocate for maternal health equity, Dr. Larkins Pettigrew. She is the first senior vice president and the chief clinical officer of diversity, equity, and inclusion for Allegheny Health Network, Highmark Health. Dr. Larkins Pettigrew is also the founder, current CEO, and president of Just One Door, which stands for Women and Newborns Diversity Outreach Opportunity and Research. It aims to educate global medical providers through local and international healthcare collaborations. Today, Dr. Pettigrew will be having a conversation centered around improving maternal outcomes for women of color. Please join me in welcoming Dr. Larkins Pettigrew.
Good afternoon. Good afternoon. Such a wonderful week focusing on what's so important and should have been the topic of many conversations decades ago, because we haven't seen very much change in how African-American Black women are treated in this country and as it relates to making this journey through pregnancy. So I want to talk to you a little bit today about, how we use collaboration and how we as an institution here at Highmark and in some places in the other country have really jumped in with both feet to say, how do we make this work? And so if you want to pull up my first slide, it just really want to really focus on, I was introduced, but, who am I? I'm an African-American woman. I am a veteran. I am a disabled veteran. I am a woman, and I'm a little mature. Let's just put it that way. And you can call it what you want. I'm going to call it mature, but I'm of age. So if you go to the next slide, the issue around why so many mothers and babies are dying in this country, we know there are multiple factors, but we also know that there are some things we really need to focus on. I'm sure you've seen this slide hopefully before, and it's always asking the question, why is it that we have so many mothers and babies dying in this country? But they're dying all over the world. The issue is that we're a really rich country, and that should not be happening here. If you go to the next slide, this is just should be my disclosure side, but this is about the why. So the why really is, how did we get here? And you can just do it to the next slide as well. And I always want to start with where we are as a country related to where the worst cases of mothers and babies are dying. And this is a slide that I borrowed from the March of Dimes, and it really is about how we are doing so badly as it relates to grading ourselves as a country and related to babies who are dying. If babies are dying, then moms are not as healthy as they want. There's something that is happening. And I believe, and I reflect this a lot in my conversations, is that we have to think about how we start here and what are the toxins that follow us throughout the pregnancy. And I'm sure many times you've talked about this throughout the whole week about how we got here in the first place. But if we were grading the country, you can see where we are in this slide, which is really small for me. So I'm trying to read what it says. But basically, it looks at the country in many of the states that we're doing so poorly in. And those are the darker shaded slides. And then if we go ahead to the next slide is what grades we get. And so every state is graded upon what they're doing as far as the survival of babies. We know that in every country, and I work a lot internationally, and there's places where you don't have a choice. Death of babies is something that is acceptable. Well, it should not be acceptable, and it should not be acceptable here, especially. And if we take care of thinking about how we have healthy babies, because in every country, the health of the country is judged by the health of their babies. And the health of the babies really is dependent upon the health of the mother. We can't do one without the other. And if you look at the grades there, I mean, the ones that are in the red, that are in the lower southern states, they get an F grade. And that means that they're doing extremely poor as it relates to mothers and babies dying, but they haven't improved and they continue to get worse. And there's been many, many documentaries about these states. But there's some states that are doing okay, and we want to know why. If you go to the next slide really is, how did we get here? And I always want to talk about how we got here, because until all of us understand how we got here, we can't move from here. And even we talk about blacks and whites, even our African-American sisters and brothers don't really understand how we got here because they are in the midst of it. And so if you go to the next slide, I want to really make sure that we are thinking about, how we got here and why we need to move forward. And hopefully, can you play this video for me? I hope that we actually download it. And so we can take a look. This is a model that I'm using, that I've used before, that we're using here in Pittsburgh. I think, oh, great. Thank you. So this is actually kudos to First Year Cleveland, because I work with First Year Cleveland, and this is a model that has been used in several of the cities, and really drives home the issue of how did we get here? How can we move from here? But we can't move from here unless we understand how we got here, how we embrace that, and how we then begin to develop programs in a collaborative fashion around how we move into a space where we're all trying to take care of mothers and babies. If you go to the next slide, this is how we intentionally invest in humility. And so those three words, intentional investment and humility, is where I think we need to start. Because in this institution where I just came from Cleveland here, I only said yes because this is a place where they were intentionally embracing where we have been, how we got here, and how we're going to move forward. Investing workforce, finances, and really having a heart for humility to understand how we do this through compassion, through empathy, and through really making sure that we hear the voices of women. And so if you go to the next slide, I just want to tell you a little bit about, how we really want to move forward. What we're calling here in Pittsburgh called First Steps and Beyond. So in First Steps and Beyond, in the slide that's in front of you, really talks about the fact that we lose so many babies, Black babies, before they have their first birthday. It's the same concept as Cradle Cincinnati in first year Cleveland. And I have to really make sure you know that video was made in Cleveland by First Year Cleveland. It is such a wonderful, wonderful video that really lays out for us where we are. Because we know if we save Black babies and allow them to have their first birthday, then we also allow all babies to have their first birthdays because of the interventions. But then we really make sure we pay attention to what's happening in mothers along this journey. So there's four components of this First Steps and Beyond that we have started at here at Allegheny Health Network at Highmark. And first thing that we really want to talk about is what's happening to women and why are they in this space. And one of the big things we know, data supports it. We want to really rest on the fact that we have the data. We don't need to collect more related to how we got here and what are some of the issues. The first thing that is in the middle of that bubble is we need to reduce racial disparities. What happens to women when they're not listened to, when they're not taken care of with dignity and respect? What happens to them when they feel like they don't have a partner with their clinician? Then secondly, what about preterm labor? Why are so many African American and Black women having experience in preterm labor? And there's multiple components to that. It could be anywhere from pregnancy separations, as far as when we're having our babies, but there's much, much more to that, as far as the toxins that we have are subjected to all the time, micro and macro aggressions that we continue to have even when we're in pregnancy, that really results into extreme prematurity. And then the third component is what's happening to our babies once they go home, and why don't they have safe places to sleep? Why don't they have pack and plays and baby boxes? And why aren't we taking care of that space where our babies are safe? And that also means that if our baby's going to be safe, mothers have to be safe. So in that fourth trimester, how do we control that fourth trimester and really make sure mothers are surrounded with a village, that they're really taken care of, that we're thinking about their mental health as well as their physical health? Next slide. So the next slide really talks about imagine if, and this is really kind of a list of the things that we think about. And I always say, well, imagine if we all came together and we're not working in silos. And I can't read it, so hopefully you can read it. But this is the one that I talk about, us coming together in a collaborative way. What we have done here is we really have put together as an orchestra, we as the conductors, Highmark AHN as the conductors, who are saying we need to not work in silos, because we've got Healthy Start, we've got all of these, our doula programs, our community health workers, and all of these really wonderful opportunities for support, to offer support to women. But imagine if we all put all of this effort together, that we as an orchestra bring, more than right now, we have about 52 organizations that have signed an MOU to say, we are no longer going to work in silos, because we're making taking care of mothers the target, the actual way that we're going to progress through collaboration to improve maternal health, which is what this is about. You've heard all week long about all the advocacy and all the things that we need to do to step up and say, this is an issue that we will never ignore again. So what that means is that we have to have action items. How do we move into a space where we're all working together and we're not competing? So that we want to have this orchestra where people can step up and say, I do this well, but I need more support. So how can we support you in order to increase your doula services? How do we support you if you have a birthing center? What do you need in your birthing center that we, as the conductor who's raising money, can help you and support you in that effort so that you have more staff, or you have an opportunity to have even a community health worker. So to kind of get that idea that we're bringing all this together in a collaborative way. If you go to the next slide. Now, the next slide really is the four-pronged approach that I talked about earlier, and how we're approaching this issue of fetal death, which means that we have to approach the issue of making sure moms are healthier. So the whole issue of structural racism and how we really break down those barriers. And that is where we need to start across all of our healthcare systems. In our city, we have two major hospital systems. We deliver at my system 10,000 babies a year. McGee Women's Hospital, UPMC, 10,000 plus. All of our FQCs that touch women, all of our community organizations that touch women. We want to come together and say, whoever's touching a woman, we want to make sure that they are educated, they have cultural humility, they're listening to women, and they are taking care of women in a space that they feel safe, and that they recognize that women are responsible for not only themselves and self-care, but they're taking care of their families. And so how do we do that? So we do that through education. We do that for making sure that everybody's on the same page related to a common purpose, common language. Everybody is listening to one another in this space of understanding how we got here, related to structural racism. What are we doing with our clinician, and how we train the clinicians that they must be partners? Part of that is really making sure we have centering care. The centering care pregnancy programs. We have now brought in 4 new centering pregnancy programs in our system, and we're looking at making sure they're placed in all of the systems that actually deliver babies and just do prenatal care. That they have data that says if we bring people together, we bring women together, and they have these support systems, they do better. We have less prematurity. We have more full-term births, and we have more women who are supported during this pregnancy journey. The second one is bringing together high-level maternal fetal medicine educators and providers who make sure that they understand that there's multiple comorbidities we enter this space with. We have to take care of those, as well as make sure that women are not subjected to undue stress during the period of this journey. The third one, of course, we talked a little bit about women and taking care of the children at home, and how we make sure that they have a place for their child to sleep, that they're not rolling over on their kids when they're sleeping. But it's more than that. What else is in that space that will help them really be good parents and help take care of their parents once they leave our system? And making sure they go back to some of those community sites that offer all of the support that we know exist already, and just lift them up. And then the fourth prong, of course, is postpartum. What in that postpartum period do we really need to attack so that women are not committing suicide or not into major depression? So they're taking their iron, so they're not fatigued. They can get up and take care of their children. That's the other big space that we really were working. So a four-pronged approach, making sure that we have a number of our community efforts and community collaborators at the table, key stakeholders, making sure we have philanthropic support as much as we can to make sure that we're supporting those organizations. If you go to the next slide, and the next slide is really what we know already. We talk about what happens to women in all socioeconomic spaces. What happens to women if they're not listened to? What's happened to women themselves if they don't know their bodies? This is just a prime example of a woman who knew her body, who listened to her body, but who didn't get listened to. She was listened to. Her physician actually heard her. It was the nurses who didn't hear her. So we're talking about everyone who touches a woman has to be educated as to what it takes to give them the best care, to make sure this journey is safe. The next slide probably also looks at, I think this is the one about, yes, the young woman who was not taken to the hospital. Why did she not go to the hospital? Why didn't the ambulance driver say, well, you can't afford to go to the hospital? What bias entered that space that left this woman at home and did not take her to a place where she could get help? So looking at how we look at the system of structural racism that runs through every aspect of our lives, not only in healthcare, but how do we really target that to make sure that is one of the issues that we can no longer tolerate, that we have to take action and make sure we are doing what we need to do to educate and to put people in positions where they really can function very well. The next slide. The next slide, also, we talk about Kira, and her husband, Mr. Johnson. He talks all the time about what's happening here, what happened to his wife, watching his wife die at Cedars-Sinai. I mean, can you imagine being there and calling out for help to say that my wife is in trouble and not be and even the father was not listened to, and now this young woman is gone. That should not happen. We should not have a society that tolerates this behavior. So she should be here. The next slide is really a little bit about how we have set these 4 goals, and I'm going to go through them quickly. You've heard already about the 4 goals. That first one, reducing racial disparities, and you'll have access to these slides as well, and how we do that through not only education, advocacy, making sure that you've heard all week long. To summarize, what are we doing at the political level? So the political determinants of health actually result in the social determinants of life. And we have to be in that advocate space. And you've heard this from many of the providers and the presenters this week, is that we not only have to advocate in our own communities and our healthcare systems, but we have to be at a higher level where we're making changes in policy that affect our women. The next slide is also, as we go through this very quickly, the next slide is not only addressing that racial disparities, addressing extreme prematurity. We're talking extreme prematurity. And what happens to those women that have a loss, which it should not happen. And so we want to make sure that even if we have a loss, that those women are taken care of. Next slide. The next slide is about preventing sleep deaths, what we talked about a lot. And then the fourth one is 4th trimester and how we actually deal with women and making sure that they are in a safe place and that we are taking care of them like we should as a village. And then I think the last few slides that I'm just going to go through pretty quickly, because you'll have access to this, is that what we've done here is really to make sure that we have joined this as a community, collaborative community, that we're working to make sure that all of our community supporters, our doulas, our healthy starts, that we're in this together and we're going to be focused on what we do together. Can you go to the next slide? All right, this is just kind of an outline that you'll have available to you as far as it's like a logic model, short-term, long-term goals, as we put this together in a very strategic way when we talk about action. And that is really moving forward to make sure that we have the attitude that we should never tolerate the death of a mom and the death of a babe, and how we need to do that in a very collaborative and community approach. And then the next slide is, let's see. And this is the teams that we've set up. And if you look at the teams very closely, they really are addressing those things that women are subjected to every single day, related to those stressors, related to how we come together in their workplace. And this is an actual guide for you to say, okay, here are these committees. Let's think about what these committees do. Here are the action items for you. And this is why you stayed here all week and listened to all of the presenters, because hearing it and actually taking action is very different. And this is a guide for you as well. Next slide. This is just what happened in Cleveland, looking at the reduction in death of babies. They decreased the death of babies and went from about, I think it was 13% to 7.58%. When we calculated, they decreased the death of Black babies by 28% in 5 years. It can be done. This is an action model that I still believe in the process that they used in Cleveland. Still are working, took that model and are here in Pittsburgh doing the same thing. You can do this in your own spaces as well, but you cannot do this alone. It is about progressing in a collaborative way to say, we're not going to tolerate this for our mothers and babies anymore. Next slide. And this is where I want to take any questions from you. I have coffee and donuts together, so they're holding hands. Kind of my way of saying, they go together collaboratively. They taste good together. This is something that we should be doing. So how do we progress through collaboration? That's how we progress. That we take this a step further and say, we're going to work in all of these spaces to make sure that mothers have an opportunity to have a wonderful journey through pregnancy and have healthy babies. I'm going to stop there and I'm going to take some questions.
Thank you so much, Dr. Larkins Pettigrew. This was phenomenal. I love all that you were saying and educating us about. So we did have a few questions in the chat, and I can read a few for you. One was, what home visiting services are out there that cater to women and children of color?
So not many. We're talking about having a doula and having a midwife who's going to look at how you deliver at home. There's pros and cons about doing it as well. I don't support it, so I'm just saying that they do exist, but absolutely we're in a place where we're doing all of this digital practice of medicine, but that digital practice of medicine has to come with those things that make moms and babies safe. And if there's an opportunity for people to begin doing home visits, I have a friend of mine who is primary care that does home visits, but even people letting mothers check their urine at home, take their own blood pressures at home, and all those things we should advocate for. But if we don't get the funding that covers that, then we can't give them that care. Someone who can take their blood pressure at home, someone who can tell us what's going on at home without having to navigate bringing children and having an appointment will make a very big difference. And that's when we talk about internet space of social determinants of health and how we can really make a difference. And that's another space, absolutely something that we should think about and talk about. I think you're on mute, Judith.
Yes, you're right. Absolutely. I said absolutely, definitely. We definitely have to keep those in mind. Another question was, what role can maternal health coaching play in reducing disparities?
So coaching for who is the issue? Because when we talk about reducing disparities, everyone has to be at the table. It is not just the mother who is choosing to have a baby. It is her whole village and who's around her family and how that works when we talk about coaching. But coaching also really refers to what happens in these healthcare systems. What happens when you make that first phone call? So when we talk about coaching, it is really about educating through humility and really being there as a support person or support organization that allows a woman to go through this journey feeling safe, feeling healthy, and making sure people are really relating to them in a way that they feel comfortable. So when we talk about coaching, it's such a very important component of making sure this is a safe journey. But where does it fit in all of this? Because it's a positive, but where does it fit? It's going to make the most impact.
Yes, definitely. Another question that on our end was for CQI and health equity lens review. What data elements and their variables should we be looking at that will be useful to the progression of this work?
So when we think about CQI, I always worry about, are we asking the right question? Because when you talk about data, I always think about data justice, right? And many times we're not asking the right questions. We're not getting the information that we need to make great decisions. And we have to always go back. So when we talk about race, ethnicity, we talk about, socioeconomics. There are many more things that involve when we talk about birthing people that we need to think about as far as asking specific questions. But what we do with that data is essential. For many years, we have ignored data. And to this day, people say, data doesn't lie. Data does lie if we don't use it in an effective way.
Yes.
Because we can have all the data we want, but if we are not collecting the data in a proper way, using not only just surveys, but focus groups, the surveys themselves, one-to-one interviews, how we get that information, then how we take that information and actually analyze it in a way that allows us to see the good, the bad, and the ugly before we make those decisions as to how we move forward. And then taking that information and saying, okay, so we have their information, we've gathered it the right way, we analyzed it the right way. How do we use that information for good? And there are many places still when we talk about gathering that information and using that data that we really have to think about, is this data really going to make a difference when we think about looking at equity through a social justice lens and how we're going to measure outcomes if we have to pivot because we found something that doesn't work. And that's the whole issue around data. We have to be in that space of collecting data for justice all the time. And this is a space that will really work for us if we do the right thing as far as managing what data we can get and how much more we need to get.
Yes, you have the chat blowing up about this. They really truly believe in data justice, and you're just sharing the same sentiments that we are definitely pushing here. So I truly appreciate that. One last question. How can we productively work together when for decades we have been in silos and have been accustomed to not truly collaborating effectively?
So I barely heard the question, but I'm thinking reading the one that you asked me about.
Okay.
And so that's why we're here in this place of collaboration. You think about everybody's out there, they're doing their own thing. You've got people competing to get, right for grants because I want to do this well. and everyone's competing for finances to survive in their silos. And many of those people who are surviving are doing some really great and valuable work. So how do we lift them up? How do we bring us together so we're not working in silos? And that's what the first year Cleveland folks did. That's what we're doing in Pittsburgh. We're saying we don't want your money. We want you to keep writing for grants. We want you to keep working for that. We want to gather a bucket that is singly focused on this particular target, right? And so if you're doing well and you have a doula service, and we want to expand doulas for everybody, so that maybe we don't have Medicare and Medicaid is paying for doulas. How can we advocate to make that happen? If you are an advocacy group and that's where you're going, you need funding, and we want to move with you in that space. That's what we need to do. But the target and the common purpose is around this and this alone. So we want to stop fighting about who's getting what and when. We have to come together collaboratively and say, will this work, and what impact will this have, so we can measure positive outcomes for our women. And we can't do that if we keep working in silos. We can't keep slicing the pie and think that we're not going to have a whole pie at the very end. And when I think about that, I think about women who have a great journey through this, a healthy delivery. Moms are healthy, babies are healthy, and we are moving to a place where we have cultural humility, where we can choose people who will take care of us in a way that is with dignity and respect all the time.
Yes, I truly believe in it. I think you're really emphasizing that not working as crabs in the barrel anymore. We have a common goal in mind, and I feel like you really, really highlighted that throughout your talk today. So we thank you so much, Dr. Pettigrew. You have informed us so much, and I think the chat is not going to stop going off. I wish we could have given you so much more time, but I do want to guide our audience to our next session. We thank you once again, Dr. Pettigrew, for being so informative this afternoon for us. All, please guide yourselves to the Mother Lab Policy Toolkit discussion, where we will be discussing some of our takeaway messages of today. Thank you again.